Hey everyone, and welcome back. Today is Tuesday, September 1st. Can you believe that it is already September? So we left off yesterday talking about the different structures of the skeletal system as well as cartilage, and now we're going to pick up where we left off with joints and ligaments. So the first thing you need to understand is what is a joint? A joint is when two or more bones come together, and they typically have that articular cartilage on the end of them that helps to protect the bones from rubbing together. And that is called a joint. And you have many different types of joints, and your joints are held together by ligaments. Ligaments are that tough, whitish colored bands that connect bone to bone, and this is made of connective tissue. And then later when we talk about the muscular system, we'll talk about your tendons, which are cord-like structures that attach muscle to bone. So first, let's talk about the three different categories of joints. You have diarthrosis, amphiarthrosis, and synarthrosis. Diarthrosis are types of joints that are freely movable, meaning they can move in pretty much any direction. The first one you have is your ball and socket joint. Ball and socket joints allow for the most movement because these are located in your hip and your shoulder. So think about how you can take your arm and you can completely turn it around. Same with your hip. You have a full range of motion. That is a ball and socket joint. And it's called a ball and socket joint because the end of one bone literally has a ball on the end of it. And the end of another bone kind of has a C shape or socket shape, and they fit together like that. Next, we have your hinge joint. Your hinge joint can only move in one direction, but it does allow for a very wide range of movement, and these are located in your knee and your elbow. So imagine my elbow, I can only bend it in one direction. I can't go past this, but it does have a lot of movement, same with your knee. And then your pivot joint allows for rotation, and these are located in your wrist and ankle. So imagine you can take your wrist and you can rotate it like this. You can do the same with your ankles. You can rotate them. So those are your pivot joints. Next, you have your amphiarthrosis joints, and these are ones that are just slightly movable. So this is your gliding joint, and a gliding joint allows for a joint to glide on top of another one. So this happens most commonly in your vertebrae. Your vertebrae all stack on top of each other, but they have cartilage in between, and each is connected by a joint to allow for a gliding motion, which helps you to not be a stiff board. And then next you have synarthrosis. Synarthrosis joints are the ones that are immovable, and these are fixated, meaning they have no movement. And these are typically found in the skull where your sutures meet up to fuse together to form the whole complete skull. Those joints do not really move. Here's an image to show you what each of those joints looks like, so you can pause here and look at that if you would like. You do have two joints on this page that we did not talk about, which are saddle joints and ellipsoidal joints, but you do not need to know those for this class. But if you were to take an anatomy class in the future, you would learn more about those. So we already know that one of the main functions of the skeletal system is for protection and for movement, but there are a few other functions of the skeletal system which we had not talked about. The first one is something called hemopoiesis. And hemopoiesis is the process of making red blood cells. Your bones are actually responsible for the production of those red blood cells or erythrocyte. And next we have mineral storage. Your bones are responsible for actually storing and creating many of the different minerals that our body needs in order to function, things like calcium and phosphorus. And then off to the other side, you can see again, movement, protection, and support. A few disorders of the skeletal system that you need to know. First, let's talk about arthritis. You have many different types of arthritis, but the general term arthritis means inflammation of the joint. Osteoarthritis is a result of the natural aging process and just the everyday wear and tear on our body. And then you have rheumatoid arthritis, which is actually an autoimmune disorder where your body is attacking its own joints. Then we have gout. And gout is a crystallized uric acid buildup, which usually occurs most commonly in the big toe. And then osteoporosis is the softening of the bone, making it very porous. And by porous, we mean that it doesn't have as much support. It's becoming softer and less rigid. This is why we tend to see with older adults, they might start off as one height and they actually get a little bit shorter as they age. And it's because their bones are not supporting them to the level that they were when they were younger. And so they actually decrease in height a little bit. This softening of the bones can also lead to an increased risk of breaking bones with older age. This is why when older adults fall, we tend to see more things like broken hips, because their bones are just not as strong as they were at one time. Next, we have spinal defects. And when we're looking at spinal defects, we have different curvatures that occur within the vertebral column that cause different issues. The first one is kyphosis. Kyphosis is often referred to as hunchback syndrome, and it involves the thoracic spine. And remember, the thoracic spine is the middle section of the spine, kind of where your thoracic cavity would be located. And your thoracic spine starts to curve outward, meaning you kind of look like a hunchback. Next, you have lordosis, and lordosis starts with an L, so you can remember that it involves your lower spine or lumbar spine. And lordosis is when it tends to curve inward. So you see here on the image, their spine, their lower back curves inward, and it makes them stand kind of funky like that. And then scoliosis is the last one, and scoliosis starts with an S, and it is the S-shaped syndrome, which involves both the thoracic and the lumbar spine, and it's when your spine is not straight, but more in a curved S shape, and people tend to stand off to one side, or they just stand kind of uneven. Fun fact, my boyfriend actually has scoliosis, and sometimes you'll actually catch him standing in certain ways, and he doesn't realize that he's doing it, but I can tell just from looking at him that he's standing in certain ways because of the positioning of his back. Next, we have dislocations, and dislocations are just injuries where your joint is forced out of a normal position. So it's not a complete break or anything like that, but it just means that the joint is not connected where it's supposed to be. And this can usually be caused by falls or sometimes auto accidents, like a car accident, or commonly participation in certain sports. A dislocation is very painful, and it immobilizes the joint because it's unable to move in its normal range of motion like it was before. Examples of common areas where you might see a dislocation are things like shoulder joints, elbows, fingers, ankles, knees, hips, and our jaw. And these are all joints that we use a lot, and so they get kind of worn out and stretched out and can be weaker, and this can lead to a dislocation from some traumatic incident. You do need to have prompt medical attention when you dislocate a joint so that you can get it back into place properly, and then typically you need several weeks of rest. Here's a fun story. Well, it's not fun for me, but it was fun, I guess, funny to look back on now. I dislocated my knee 4 years ago, I believe it was, fishing, which is not a crazy sport that involves a lot of physical activity, but I was walking down a hill and it had rained the night before. It was kind of slick, and I slipped and my knee went one way and my body went a different way, and I dislocated my right knee. Well, the person I was with didn't really know that this happened. They were on another part of the lake fishing, so there was no one around me. I was completely by myself, and the only way I could get up to get help or to do anything was to pop my knee back into place myself. I do not recommend that you do this. It's very painful, and you can really injure yourself in the process, but I did. I popped my knee back into place. It hurt really bad. And then I crawled up the hill and went and found the person that I was with. And to this day, I actually still have really bad knee pain occasionally and have to be careful climbing up and down ladders and walking really long distances and things like that because of it. So dislocations are very serious and need to be treated with medical attention. Try not to put it back in place yourself. Okay, next we have types of bone fractures. So we have 6 different types of bone fractures that we're going to be talking about. The first one is a green stick fracture, and green stick fractures are basically incomplete fractures. These typically happen more in children. It's where the end of the bone might splinter, but it doesn't actually break all the way through. And the treatment for this would just be to have it casted or put in a splint. The picture on the bottom with the blue arrow is an example of a splintered or a green stick fracture of the collarbone. Next, we have simple fractures. You may hear this referred to as a closed fracture. And the reason for this is because it's when you break a bone, but it does not poke through the skin. So your skin is closed. So this is a simple, very common fracture. And the treatment for this would also be a cast or a splint. Next, you have a compound fracture, and this one is called an open fracture. And compound fractures are one of the most and compound fractures are when the bone is broken and it actually pokes through the skin, so you can see it being pushed through the skin. It is one of the most serious types of fractures because it can cause infection in the bone and also the tissue surrounding the bone, because you're exposing the actual bone and tissue to the outside world and environment. Next, we have hairline fractures. Hairline fractures are when you do not completely break or displace a bone, and it's very, very tiny, thin fracture. Hairline fractures still hurt pretty badly. I'm pretty sure that in college I got a hairline fracture in my foot, but I actually think it was just so thin that you couldn't even see it on an x-ray. I did it while I was biking. I was riding a bike. There were some people coming up a hill towards me. I couldn't stop, so I just slammed my foot down on the ground, and it immediately felt like I had broken my foot. But when I went to the doctor, they did an x-ray and they didn't see a fracture anywhere. But I am convinced, because of how much pain I was in and how long it took for it to heal, that I probably had like a hairline fracture in one of my metatarsals that they just didn't see. But yeah, that's when it doesn't really completely break through and it's a really thin fracture. So the image of the hand down there on the pinky finger, there's a hairline fracture right where the arrow is pointing. A spiral fracture is caused by a severe twisting motion of a bone, which is what the image in blue in the upper right-hand corner is. And this is most commonly caused by either like skateboarding, rollerblading, riding a scooter. These types of incidents typically are what cause a spiral fracture. And then comminuted fractures are when the bone has actually fragmented or splintered. And these are very typically seen in the skull or facial bones. And then in this image, it's in the arm, in the humerus bone of the upper arm. Treatment for this is that you typically need to have surgery in order to replace all the bone fragments that may have splintered off. And it may even involve some type of external device to then hold those fragments together. Some different treatment procedures for fractures are closed reduction, open reduction, and traction. Closed reduction is just like a cast or a splint, what you commonly think of when you break a bone. Bony fragments are brought into alignment by manipulation of the outside of the body, and then a cast or a splint is then applied. So this is where you don't have to actually have surgery to fix it. They just go in and they are able to kind of manipulate the bones back in place, and then they put a cast on it in the hopes that they will fuse back together on their own. Open reduction is when you have to have actual surgical intervention. So devices such as wires, metal plates, or screws might be used to hold the bone in alignment, and then a cast or a splint might be applied. In some cases, they will leave those screws in place forever, and you may just always have a screw in your arm. But in other cases, they may go in later and take those back out. I broke my arm in 3rd grade. Actually broke my arm and a bone in like my elbow area. And I had to have open reduction surgery because they had to actually go in and like put pins and stuff in my arm to hold it in place. And then I had a cast that came all the way up to here, all the way down the length of my arm for several weeks. And then traction is pulling. It's like a pulling force that they use to hold the bones in place. And this is used for fractures of really long bones. So if you were to break like your femur, your tibia, your fibula even sometimes, they may have to use this procedure to hold those bones into place. And this involves a series of weights and pulleys to do gentle pulling. It's definitely uncomfortable, but sometimes in order to make sure that your long bones fuse back properly and that you're not going to have like lopsidedness, this is the best option. And then there is an image right there of what that might look like. And then lastly, we're going to talk about sprains. And what is a sprain versus a strain? A sprain is the overstretching of ligaments versus a strain is the overstretching of tendons or muscle-related injuries. So sprains are related to the skeletal system, strains are related to the muscular system. The most common location for a sprain is in your ankle. If we roll our ankle off to the side, then that that ligament on the outside of our ankle is really common to sprain. And then typically a mild sprain can be successfully treated at home with just rest, ice, compression, and elevation. That's where the acronym RICE comes into play. If you've never heard that before, R for rest, I for ice, C for compression, and E for elevation. So that's the difference between a sprain and a strain, and that is everything for this section of the skeletal system. If you have any questions, as always, feel free to text me or email me, and I will get back to you as soon as possible. Bye, guys.